Hi, my name is Dr. Tanya, and I'll be diagnosing you today. Who do I have the pleasure of speaking with?
So this is your patient here, and her name is Khadija, and this is
Khadija?
her aunt. She's going to be our informant for the patient. Her name is Saada too. They
Mm-hmm.
are all happy to see you.
I'm happy to see you too.
All right,
So, would you mind if I asked a few questions to get to know you?
all right. So tana so ta ki dan ba ta labari akan ki kaɗan, kamar shekarunki, ko kina makaranta, ko kina aiki, ko kina wani abu. Mm? Okay. Shekaranki nawa kenan? Okay. Shikenan. Ba ki gaya mata wani abu ba. All right. So this is her auntie Saada too. She's 20 years old. She just finished her high school, and she's not currently working.
All right.
So this is the patient, and the patient, she is the eldest daughter of her mother's three children. She has two siblings who are both males. She is 6 years old, and she is going to school. She is in nursery too.
Hey, does she like going
Yeah.
to school?
So tana son karatu sosai. Ita Khadija. Khadija lokacin da take zuwa makaranta tana son makaranta ko tana gudu. All right, that she likes going to school.
That's perfect.
She
All
was
right.
doing well before this pandemic, so she's currently at
Mhm.
home. But before the pandemic, she was doing well in school.
That's awesome.
Yeah.
So, um, would you mind talking about some of her favorite things to do? Does she like to play outside during the
So
pandemic?
tana su me tafi son yi kaman abubuwan wasa haka me tafi son yi? Alright, irin na waka kenan. So tana son wasa irin da yara hakan nan sa'anninta. Mm. All right. So she loves playing with her mates outside, and she also loves singing. And she sings all the songs they taught them in school, and she's very good at it.
That's so awesome.
Yeah.
All right. When she plays outside, does she wear long sleeves regularly, or are there any mosquitoes around where she lives?
Okay. So a inda kuke zama din akwai sauro ne? Okay. Ana yawan sa mata kaya mai dogon hannu ko dogon wando ko kuma ba a yawan sa mata. Eh, ko dogon wando. All right, so that she doesn't often wear long sleeves uh, shirts or pants, and they have mosquitoes in their surroundings.
All right.
Yeah.
So one last question, if it's all right, can I know a little bit about her religion and if she has any
Okay,
diet
so
restrictions?
all right, so akwai wani irin abincin da ba ta ci ne? Okay, all right, that she doesn't have any restrictions for any food. She's a Muslim. Her parents are Muslim.
All right.
Yeah.
So what brings her to the hospital today?
Okay, so me yasa kuka zo da ita asibiti, me yake damunta? Okay. So she said they brought her to the hospital because she has fever, um, body weakness, and also she's also having a headache and loss of appetite and shortness of breath.
All right. So how long have you noticed the fever, and has it been like constantly getting worse, or has it been on and off?
So wannan zazzabin nata yana ƙara tsanani ne kafin ku zo asibiti? Okay, kuma zazzabin da yaushe ya fi mata? Da yaushe ya fi safe da rana da yamma? Da yaushe? Da yaushe ya fi tsanani? All right. So the fever is more at night, in the evenings, and it keeps increasing in severity. That is why they decided to come to the hospital. And it
Uh,
comes and go. It's intermittent.
all right.
Yeah.
And then you said you noticed a headache. Can you describe the headache to me?
So ciwon kan nata na yawanci ina ne take cewa yake mata ciwo? Eh, bata iya faɗan kai ɗin kowane ɓangare ne a kai ɗin. All right, that she normally points at the forehead. So that is where she's having the pain. And she also has pains in her abdomen. She also have abdominal pains.
All right.
Yeah.
You also said there was a loss of appetite. How long have you noticed that for?
To tun yaushe ne wai ta zo ta ba ta iya cin abinci sosai din? Jiya ko yau? All right, that her appetite begins to decrease 3 days ago.
3 days ago. Okay.
Yeah.
And with the muscle aches, has it only been in the abdomen, or have you been noticing it anywhere else, like in the legs or the hands?
So banda cikin nan akwai wani waje take cewa yana mata ciwo ko gaɓoɓinta? All right, that she has pains all over her body and also the joints.
Okay.
Yeah.
Have you noticed any chills or paleness in the eyes or the hands at all?
Yes, this patient is actually pale. You can look at the palms. You see, it's pale. And if you
Mhm.
look at the conjunctiva, also pale. Kita kalli sama, kalli sama. You can see she's a bit pale. So
Okay.
this patient is pale clinically.
Okay.
Yeah.
So right now I'm suspecting malaria. So doctor, could you run a rapid diagnostic test so we can see if she has the malaria in her
Yes.
body?
Rapid diagnostic test for this patient was done, which shows 2 places of malaria.
All right. And then could we run a blood count test or a hemoglobin test to check her blood
Yes,
count?
the hemoglobin for this patient done is 6.9 gram per DL.
Okay.
Yeah.
So for the malaria, I would say this is not a severe case, but with the anemia, it is a complicated case. So
Okay.
I would give her an IV artesunate because she has malaria and anemia. And also because she has 6.9, that would be a severe case of anemia. So I would recommend a blood transfusion for that.
Okay, that's correct.
And just to make sure she doesn't have typhoid, doctor, is it possible to do a quick blood culture to see if we have the Salmonella typhi?
Yes, that's good. We did the culture, which shows yield cultures of S. typhi, which was present.
Who's present? Okay.
Yeah.
So then I would recommend doing some antibiotics like ceftriaxone
Okay, that's
for
good.
to treat that. And then one more quick question: has she been noticing any coughing, sore throat, or runny nose at all?
Okay, so tana jin kaman ci tana toshewa ko tana ta tari sosai sosai. All right, that she's not having a very severe cough or a nasal blockage or any sore throat.
Okay. So I just think that the antibiotics for typhoid fever, the blood transfusion for her anemia, and
Okay.
then the IV artesunate for her malaria should be good to treat this patient.
Okay, that's good. That's good.
All right.
So
And then, so
future.
for future prevention, for
Okay.
for malaria, I would recommend wearing longer sleeves and longer pants. I know she doesn't like to wear that
Okay.
when she goes outside, but that's what I would
Okay.
recommend to prevent
Okay.
mosquitoes and things like that. And also, if it's possible to get a mosquito netting.
Okay.
Um, for anemia, I would recommend eating more fruits and vegetables that are higher in iron.
Okay.
And for typhoid, I would recommend washing your hands and keeping clean hygiene because that is very good at preventing typhoid fever.
Wow, that was great, Tanya. Um, you were able to suspect that this patient has anemia, malaria, and typhoid from her symptoms she presented with. And you were able to carry out the correct investigations, rapid diagnostic test for malaria, which confirms your diagnosis of malaria, hemoglobin levels, which confirms your diagnosis of anemia, and blood culture, which confirms your diagnosis of typhoid fever. So this patient has malaria with typhoid complicated by anemia. So you had the correct diagnosis, Tanya, and you also suggested the correct treatment for this patient, artesunate for complicated malaria, and the IV antibiotics. You specifically say ceftriaxone, which is very good for this patient. And you also suggested blood transfusion for this patient. As you can see, the patient is already on blood transfusion. You can see on the camera. So what you did a great job, Tanya. You also go ahead to suggest future means of prevention for the malaria, wearing of long sleeves, mosquito-treated nets, and hygiene for the typhoid and anemia. Future prevention. You stated it correctly. So you have done very well, Tanya. You are very great. Congratulations.
Thank you. I hope she feels better.
All right. So ta ce
Um,
wai tana fatan Khadija ta samu sauki kuma ta gode. So they said they are very grateful and for all what you guys have done to them, and they are very happy.
okay.
Yeah.
Stay safe. And I hope that she does get better.
All right. So congrats, Tanya. Once more, you have done great. Congratulations.
Thank you.
Yeah.